So I have now with me Gert-Jan Kopman, the Director General of Budget, who will present the Emergency Support Instrument.
Thank you very much, and good afternoon. Let me walk you through the third element of this triptych, which is an unprecedented EU-level intervention in favor of the healthcare systems of the member states. In essence, what I want to talk about is the objectives, what we can actually finance with it, how it is financed, and what this requires in terms of legislative changes. So the objective of this measure is to support member states' healthcare systems in a very fast, flexible and coordinated manner by effectively intervening in areas where there is clear European value added, and therefore where the action of the Union provides tangible benefits compared to member states acting alone. We act in solidarity and directly help those where the needs are greatest. Interestingly, earlier today, Maarten Verwijt talked about an instrument based on Article 122. This particular instrument is equally based on Article 122, so the solidarity article of the treaty. And thirdly, by taking this action, we assist national administrations in managing the ongoing health emergency and its aftermath by providing actions that contribute to coordination and support of these administrations. Those are the objectives. Now let me, before I go into more detail, give you some concrete examples of what can be covered under this instrument. As I've said, this is about adding EU value added. So one example is the direct purchase and distribution of medical supplies. As you know, at the moment, the Commission is running on behalf of member states a joint procurement exercise. To directly purchase on behalf of the member states. So that comes with greater speed, greater effectiveness, and therefore there are also clear advantages for the member states if we take this on. Secondly, the transportation of medical equipment and the importation of it across EU countries is clearly something where there is a coordination issue and where if we act at the EU level, we can provide support to national health systems, and this is also covered by this instrument. Similarly, the transport of patients, corona patients, to cross-border hospitals can be covered, and by working with member states, putting in place a coordination mechanism, we can co-finance the optimization of healthcare systems, thereby concretely saving lives. Finally, another example is that we can, under this instrument, purchase and set up mobile field hospitals which can be dispatched to those areas where the crisis is at its worst. And of course, because the crisis is not at its peak at the same time in every member state, having these field hospitals available centrally allows for every euro that we can spend a greater health impact across the Union. So that's another example of a concrete action that can be undertaken under this instrument. Now, what are we actually putting on the table financially today? Well, first, we are adding another 300 million euros to the budget of rescEU, which is building a stockpile of medical equipment. We have already greatly reinforced rescEU over the past weeks, but 300 million euros would give a very significant addition to purchase stockpile respirators, ventilators, masks, and other medical supplies, which can then be made available by the Commission to member states most in need. And there is 2.7 billion euros for the emergency support instrument, which I've just mentioned, fresh money, and the instrument which is dormant at the moment, which is inactive, under this initiative is being activated specifically for the purposes of the health crisis we are dealing with. Now, on top of these 3 billion euros, what makes the EU's emergency support instrument, which is a solidarity instrument, special is that member states can also contribute directly but also citizens, foundations, and you could even imagine crowdfunding for this instrument to support these health initiatives. And we've recently heard several member states speaking about the wish to contribute grants in a gesture of solidarity. Well, this instrument offers an excellent opportunity to make that available in a mechanism that is directly operational, because we all agree time is of the essence here. So we're offering a vehicle for directly supporting, with clear EU value added, the fight against the coronavirus by strengthening healthcare systems. So a word on the financing. This is a little bit technical, bear with me, but in essence what the Commission is doing today is emptying our pockets. We are putting all the remaining available budgetary means in this last year of the multi-annual financial framework on the table. This is it. There is no money left after this for the EU budget in 2020. So it's really a big step. And we do that by using all of the available so-called special instruments that allow money to be moved across headings, across different parts of the budget. We use fully the flexibility instrument, which is an instrument that allows us to target in a very flexible manner unforeseen needs. And we also fully exhaust the Union's option of last resort financing instrument, namely the contingency margin. So you can see that by using unspent margins from the past, existing unspent margins in headings of the budget not directly pertinent to fighting the corona crisis, and by fully mobilizing the flexibility instrument, we actually arrive at 3 billion euros. Now, in terms of legislation, the first step is that we need to activate this instrument, which gives these significant efficiencies to the Commission to disburse these funds, coordinate the response, and therefore we have tabled today a regulation, a Council regulation under Article 122 for the activation of this emergency support instrument, which in this activation decision is also being tailored to the support for the health system. And then we have a series of budgetary documents that actually would make the money available. First, a draft amending budget that invites the budgetary authority to make the 3 billion euros available. That's a decision for Parliament and Council, as you know. There's a technical adjustment of the MFF 2014-2020, which is actually significant because we're asking the Council this time to accept that the flexibility within the existing MFF is made limitless, and that we can use some of the monies which under the present rules would not be available for this initiative, but which are in the MFF for the fight against this health crisis. And then there are, as I have said, decisions to activate these three flexible instruments. So I would say in the history of the budget, this is really unprecedented in terms of throwing everything on the table, but we live in unprecedented times and we're faced with a massive health crisis, and that is why we are doing it. Now, how are we going to implement this? Well, I should maybe start by saying that we have drawn up a needs assessment, which is work in progress, of those activities to support healthcare systems that have a clear European value added, where member states have expressed an interest for us to assist. And this will be managed by a cross-departmental task force in the European Commission that will look at these needs and coordinate the intervention of the services in using this instrument. Obviously, there will be very close coordination with national health authorities, international organizations, and NGOs that can also be used to implement some of these measures on the ground. So that is up and running. Now, what are the next steps? I would say two things, really. First, we need this legislation, like the legislation that has been presented in the previous presentations, to be decided. I've explained here that some of the legislation here requires a council agreement. Other parts, notably the budgetary parts, require a decision between Council and the European Parliament. And we very much hope, like was the case for the CRII package, that this can be adopted in the next 2 weeks, so that directly afterwards, from mid-April afterwards, we can start spending the money supporting the national healthcare systems. That would give us 2 weeks to actually finalize the operational preparations, to get the implementation ready, so that du moment that the legislation enters into force, in mid-April, as I've said, we hope, we can actually hit the ground running. Those are the proposals we are presenting today. Thank you very much.
Thank you very much. Now we move to the questions. First one from Bernd Riegert from Deutsche Welle. How long shall this instrument work? And how much additional money from the member states will be necessary?
Well, we are presently proposing to activate it for 2 years. This can, of course, if necessary, be extended through a separate council decision, but at the moment our request is to activate it for 2 years. In terms of additional money, as I've said, we are proposing to fully mobilize the budget as it stands today. This will require, under our amending budget, an increase in payments of 1.5 billion euros. But as I've said, on top of that, we also offer the possibility to member states to inject further funds into this instrument, which obviously is at their discretion, but which we believe would be money well spent. Thank you.
Question from Jennifer Rankin from The Guardian, again on the UK participation. Can you specify whether this initiative applies to the UK?
This initiative applies to the UK in 2020 because the UK fully participates in the budget in 2020, but it does not apply as of next year.
And a follow-up question actually related, does the UK need to request this to take part in this instrument?
There's no specific need to request other than the signaling of needs, as is the case for the 27 member states. And on this basis, the Commission will then take action, as I've explained. Thank you.
And now we have two questions which are actually related to the previous two presentations, but obviously relate also to the EU budget as such. First question from Tom Weingartner, Energie und Management Germany. How much money remains in the cohesion funds, and when would it be available and go? And do we need a new budget for 2020?
Well, as Mark has explained, we estimate that there are approximately 60 billion euros of commitments that are still available in the ESI, so the European Structural Investment Funds, under this MFF. And they are in principle already budgeted for. However, as we explained 2 weeks ago, under this initiative, the CRII initiative and the CRII Plus initiative, we are doing two things. One, we are making available immediately 8 billion euros of liquidity, which had been foreseen to be paid only in 2025-26. So that is fresh liquidity that comes out of the budget. And secondly, today, by introducing all this flexibility and 100% co-financing, effectively we are advancing payments because member states will be able to more flexibly, quickly disperse, and because we offer a higher co-financing rate, that means higher payments in 2020 and 2021. It depends a bit on how fast member states implement, but it is certain that these higher payments will be well in excess for the 2 years of 12 billion euros. So all in all, we are looking at additional front-loaded liquidity of certainly 20 billion euros. I cannot today give you a precise estimate of how much additional money we will have to ask from the member states later to finance this, but it is clear that this cannot be financed from within the existing payment envelope.
Thank you. And next questions, which was related actually to the SURE instrument, from Olivier Lebussy, La Libre Belgique. En français, est-ce que les garanties seraient nécessaires parce qu'il n'y a plus assez dans le budget 2014-2020?
Bon, juste pour répondre à cette question, il ne s'agit pas des dépenses du budget strictement parlant. Il s'agit en fait de l'utilisation de la marge entre les décisions sur les ressources propres et le plafond du cadre pluriannuel financier. Et ce cadre, cette marge est assez limitée actuellement. Ce n'est pas une dépense, c'est une zone où on donne des garanties. Et en fait, comme je pense Maarten a expliqué, on a demandé aux États membres d'ajouter 25 milliards de garanties de plus à cette marge. Ce ne sont pas des dépenses, ce ne sont pas des contributions nationales qui doivent être payées, mais certes, ce sont des garanties de plus qui ne sont pas en tant que telles entrées dans le budget, uniquement dans les comptes de l'Union l'année prochaine.
And a final question, which is more forward-looking, from Jan Wishart at Bloomberg. How do you see the CRII2 initiative playing into the next MFF? Could cohesion funding be replaced by economic crisis funding?
Well, the CRII, in essence, transforms cohesion funding into crisis funding. That is true. Mark has explained that the President sees the MFF as a central plank of the Commission's recovery plans, economic recovery plans. So cohesion policy will have to play a very important role in this regard. But I cannot speculate at this juncture what form that will take precisely. So I believe that we've made a very strong start now, and we will definitely also next year make sure that cohesion policy contributes to the fullest to the economic recovery that is needed. Thank you.
Thank you very much. That brings to an end our technical briefing of today. Thank you very much for following us.
Thank you. Merci.
Merci.